Okay, so the DOH-10 responds together with our local government partners and partner agencies. No? So, for our ports of entry sa airport and seaport, na ato ang Bureau of Quarantine, which is under the Department of Health, to do the screening of arriving passengers, no? Both in the seaport and in the airport. So although it is correct that Northern Mindanao does not have an international airport, no? So ang mga passengers na arriving in Lagadingan Airport have already been screened if they are international passengers. At the international airports, we still do secondary screening to be sure that those who arrive are not symptomatic. Aside from the airport screening, we also coordinate with our hospitals and health clinics and barangay health stations to be vigilant in terms of detecting cases. The key to novel coronavirus and with other emerging infectious disease is early detection for early response. No? So just like what happened in our person under investigation last time in Camiguin, so they were able to rapidly report the case and our team was able to arrive quickly, isolate the patient, and get samples, no? And ultimately, negative man ang result, so the patient was discharged, improved, but that shows na our surveillance system and response works well here in Region 10. Aside from that, we also continuously engage the public through various media outlets in terms of spreading the correct information. So, what to do, how to prevent it, and what are the correct ways to protect ourselves from this novel coronavirus. So, as for hospital readiness, the Northern Mindanao Medical Center is our end referral center for the region. So, they have been prepared and are continuing to prepare. Yesterday, we were there to inspect the isolation rooms for the patients, the route, whether they have their protective gears already. So NMMC is prepared. But NMMC is not the only hospital that can handle the novel coronavirus. Actually, as part of licensing requirements, all level 2 and level 3 hospitals are required to have an isolation room, whether it's a private hospital or a government hospital. So if patients who have, for example, novel coronavirus, they can be admitted in a private level 2 or level 3 hospital. And they should be referred to NMMC for complications already or if they are critical. We would implore the public, especially the viewers of this interview, that we should always be critical of the information that we receive through various media outlets, especially the social media. If we see, for example, something on social media, before we share it, make sure that the source is reputable. So for health information, you can always validate with the Department of Health or the World Health Organization for the right recommendations. So as of now, that's the health advice that we provide because this advice has been proven. It's not the first time that we are responding to an outbreak. For coronavirus specifically, we have responded successfully to MERS-CoV and to SARS. And these methodologies are proven by scientific evidence. So we implore the public to keep yourselves informed, armed with the right information. I'm sure we can prevent and overcome the novel coronavirus.